You're listening to The Drive Home.
Alrighty, gang, it's 4:30 on the drive home for a Thursday. Wayne, Tanya, and Brian all here.
You got it.
And we are so pleased to once again have a great guest on with us this afternoon. We're talking about Dr. Ryan Jennings, the Chief Medical Officer at HSHS St. Anthony's Memorial Hospital here in Effingham. Doc, how are you, sir?
Hey, I'm well. I'm just wrapping up my my beef, egg, and tuna sandwich. If you hear me chewing in the background,
This edition of Weird Things at Subway brought to you by Dr. Jennings.
That's right. Or we can just say Dr. RJ.
Oh, Tanya's pulling out the nicknames.
Oh, my goodness.
She's been working on this all day, Doc.
Back when I was a kid, not my nickname, but the name I got made fun of was Forehead.
Forehead?
Because I've always had a very tall forehead.
Huh.
And
Really?
Unfortunately, as I've gotten older,
Yeah.
that attribute just continues to grow.
You have to have more room for more brain, right?
Yeah.
It must be it. But yeah, that was my nickname when I was a kid, was Forehead.
Wow.
Okay.
Okay.
Doc, did you have any idea what the movie was today?
I honestly did not. Now, once you said Superman, I'm like, well, but I didn't know which one it was.
Yeah.
I wouldn't have pulled that out. But
Me neither.
Great to hear Christopher Reeves. What an incredible human being that
I love him.
did so much, and so all due respect to that guy.
Absolutely. Well, let's move on to the topic at hand and more serious news. We've got, as of last night, 18 new positive cases of COVID-19 reported by Effingham County. A lot of mix in the demographics from that, and the health department again advising folks to wash your hands, wear a mask, and the big thing it seems like a lot of people are having some trouble with is it seems like we still have these very large gatherings happening around the area.
You're correct, and that's very much the concern, I guess, rolling into our Labor Day weekend, that we do try to be very mindful of large gatherings. And the great news, I guess, in that regard, you always got to look for the bright side, is the weather should allow stuff to be outside. And so, if we're going to, have folks getting together this weekend, by all means, get outside, take the opportunity to distance, get that 6 feet of space around you, wear your face mask when you can. And certainly wear your face mask where you're in situations that you can't be 6 foot from the person next to you type thing. So that I think is the only good thing coming into this weekend is that the weather will hopefully bless us with the ability to take advantage of Mother Nature and the great outdoors, which is great anyway, and be able to distance so that even if folks do get out, they can still be responsible even when they get out.
Well, and if you've seen that, I'm sure you have, of course you have, the data that came out today, Effingham has moved out of the top spot in Illinois, but we gave that up to Jasper County. So this is still happening in our area, and new cases almost every single day.
You're correct, and some of that's just it is a percentage game related just to the number of people, inhabitants. So there is a little bit of just denominator there. That a smaller population obviously has a higher percentage, almost no matter how you crack it. But you can't ignore the fact that Jasper County is our neighboring county. Mm-hmm. In fact, I guess I'd have to look at the map again right off the top of my head, but basically everybody around us still is hitting some pretty high numbers, geographically. So it's out there. Effingham County is still running, in the neighborhood of 10%, which is on the warning list. And I was a little surprised we didn't have any formal recommendations coming into the weekend from the governor. But I guess again that doesn't excuse our responsibility to try to continue to distance where we can. We're glad to have the opportunity to enjoy a beautiful weekend, and certainly everybody's looking for a day off and that type of thing. But we don't want to come out of this with unintended consequences of hospitalizations and numbers that then will force the governor to make other decisions that will impact our businesses.
Is this going to be the quietest Labor Day weekend you've had in a while, Doctor?
Well, for me, of course, yes. It is sad for me because, boy, this is the best weather I think I've ever had for the annual Labor Day celebration, or right up there. And unfortunately, a 16-year tradition comes to an end because of COVID. But I've heard, well, I don't know, it comes to an end. It's interrupted.
Postponed,
I guess I should say. It's interrupted because of COVID. But boy, I've heard so many stories from families and folks that have had long-standing traditions around this weekend, and they're revisiting how do you do that this year, or do you postpone it? And unfortunately, the right answer is definitely if you can't do it safely, then you need to just postpone it. And of course, my event, pretty difficult to pull that off. And keep everybody apart and masked, and
Sure.
Too much fun in one place. That's for sure.
But we've had, and it's so tough. We talked about this last time you were on. There's been a lot of weddings around the area, a lot of wedding receptions around the area, and some places are doing their best to having those outdoors, trying to keep them socially distant. But man, we talked about how you feel for a bride and groom trying to get married right now.
Yeah.
But this is not a great weekend to get that many people together, is it?
It definitely is not. And I think the celebration around the day is the celebration within the couple. And after that portion of the ceremony is over, figuring out a way to get outside and distance is going to be the ticket to our success.
Well, it's interesting, we were talking about how widespread it is, and just another sign of that, I think I saw some folks over in specifically Jasper County had some social media posts about looking for volunteers to help do deliveries, because not necessarily the number of people that are in isolation, which are those that have tested positive, but the number in quarantine, it just seems tremendous. And it gets to where, hey, you've really got to get an organized group getting ready to help do things like deliveries of food and, just necessary supplies, because there's so many people that are being affected. That's kind of a serious thing.
It is, and it's presented particular challenges in the workforce. Mm-hmm. And as we're trying to work very closely with our public health department, that quarantine piece presents very big challenges, because those folks are potentially out of the workforce for 14 days. Mm. And, there are normally multiple contacts that it's the same peer group often. And so all of a sudden you lose out on an entire section of your workforce. And I know hospitals are not immune to the issue that we're seeing there. Other businesses are feeling that impact too. And, so everything we can do to try to shut down that spread and reduce the idea of close contact, because you become quarantined if you were identified as having been in close contact.
Right.
So anything that we can do that reduces the number of close contacts will make the health department's job easier, and will definitely keep workers available to be in our workforce, not to mention, of course, the whole idea of reducing the number of potentially ill people that will impact our ability to mitigate the circumstances around the Restore Illinois plan and keep our businesses open.
Yeah. Doc, does it surprise you at all? I mean, it does. I guess I'm more fascinated by this than anything. The demographics of people that I see that are of the, well, I guess you could say the no-mask crowd, whatever, the anti-mask crowd, the folks that don't want to follow the guidelines at all with this. I'm surprised by the number of young people that I see that just seem to be throwing caution to the wind with this, just totally, and I mean young, and I'm talking under 30, sometimes under 20, that just seem to be totally just throwing this to the wind, that they don't, I wouldn't say they don't care, but they're not following it at all.
Well, I guess I'm not surprised, simply because it's kind of the nature of that, and it's all of the age group, but it's also the nature of with schools coming back and colleges opening, and I mean, gee whiz, I guess if I turned back the dial on my own life, and I was heading into college right now, or had been at college for 2 weeks, boy, there's a lot of things that you do that maybe weren't the best decisions.
Maybe.
This is
so
true.
I'm not entirely surprised that that demographic is not being terribly attentive to the rules. But that means, just like as a parent and grandparent, et cetera, you've got a personal responsibility to try to make sure then that, because they likely will do well. I mean, that's part of it, is those folks in that demographic are very likely to get it and get sick and then be okay. But their risk is that they're exposing others. So, it becomes incumbent upon us old people.
Hey, now, be nice.
Tanya's not old. Tanya's not old. Right?
No.
But I'm old, and so it becomes incumbent upon us to be careful ourselves, and again, making sure that we're distancing, avoiding gatherings, using our masks, those types of things as best we possibly can. And really, the key there is distancing, because the mask is really about them, you not spreading it. It's not known yet to be terribly protective, although we do think it probably has some benefit. But it's really going to be about distancing and avoiding large groups.
And don't you think, I heard a report earlier today, which I thought, wow, that's kind of an extreme, but for asymptomatic people, they, when I say they, it was like the national media, I can't think of which network I heard it on earlier, but they say if you leave your house, you have to assume you're going to get it. And if you treat it like you have it, then you're not going to spread it, or it's going to not spread as much if you already think you have it. Is that something that, would be true? I think it's kind of far-fetched. Or do you think they're just trying to say, not that they're trying to scare people into staying home, but maybe that's something that they would be a little bit more careful when it comes to all of the things that you talked about before with masking, social distancing, washing hands, the common sense stuff?
And to me, that sounds like, and I also have no idea what news organization that was, but to me, that sounds like they're trying to promote the mindset, of assume you're infectious, assume that you could harm another person by going out. And so, that assumption then should compel you to wear a mask, avoid those close contacts, socially distance, avoid large groups, wash your hands. So I'm just, my thought would be they're trying to promote a mindset. The reality is, when we look at the positivity rate in blood specimens of the percentage of people that appear to have probably had the disease based upon antibody production, but didn't necessarily get sick, it's upwards of 10 times the number of people that we know that got sick, which is actually really good news in the land of the idea of the herd immunity idea going. There's a lot more people that maybe were exposed, got it, didn't get terribly sick with it, thought they had their allergies, took an extra Benadryl or whatever and went on and didn't get terribly sick with it. So that could be really good news for us in the long run, but it certainly doesn't downplay the fact that this is the by far the deadliest virus that we've dealt with as far as loss of human life. We're fast approaching the 100-year mark as far as the number of lives lost to this virus. So for a record-setting number. So
now you mentioned
it's still serious.
You mentioned the antibodies. Where could someone go to, get tested to see if
Get
they
an
have
antibody test?
Yeah.
A lot of folks, everybody's doing it. You can get it done. Our hospital does, and I'm sure surrounding hospitals do it. The struggle with the antibodies at the moment is just that we're not totally sure what it means yet.
Okay.
So we're making an assumption that if you have antibodies, we know that means you were exposed to the disease and that you mounted an immune response to the disease. We just don't know if that immune response offers long-term protection. So, like, you won't get chicken pox twice idea, which we've all seen a few of those. But generally speaking, most viruses, you get it once and you're done with it. And the titers will tell us, the antibody testing will tell us that you've had it or been exposed to it enough that your body mounted an immune response. But because this virus is so new, we don't completely know if that then conveys lifelong immunity, seasonal immunity, no immunity. So it's a bit of a debate. There was a reported second infection, I think last week or the week before, which was the first report of supposedly someone having had the virus and then getting it a second go-around. But that's not a very big number when you think about how many millions of people have had it. So,
Right.
That gives me some reassurance to think that folks that have it most likely are immune. It's just, we tread cautiously on that because you don't want to give a false sense of security around the idea that, you had it once, you're good to go, and then we find out we're wrong.
Hey,
Yeah.
Doc, we've gone pretty long here, and we need to wrap it up. But I do want to say one thing real quick here. You just touched on this when you talked about the not yet on the antibodies. A lot of people see Facebook posts, they see things online that talk about, they've changed it again. The CDC has new guidelines. Now they're saying this. Now they're saying this. No one knows what they're talking about. But what they forget is, and I'm sure that you understand what I'm saying here, this is a new virus. And the science takes a long time to work all the way through this, right?
Yeah, that is a spot-on comment because when you think about how long it takes for most medical research to progress, this thing has been studied and more progress has been made in just a little over 6 months. And the first case in the United States was in the end of February, beginning of March. That is in medical science time. That's nothing. So we've done great work, and unfortunately, folks have to be patient. And I do think that we try to make assumptions based upon a historical record of other viruses and the things that we know about how things usually work. But you'll always hear us be cautious because this thing is different. We've never seen anything like it, and so we can't guarantee that it's going to behave like viral predecessors.
Exactly.
Okay. Oh, by the way, Wayne probably can't even fit through the door now because you said he had a spot-on comment. He thought he was just the king. Dr. Moran to the rescue.
No. We'll save that for the professionals.
It's not always good to be the king. I'll warn you of that.
We'll save that for the professionals like Dr. Ryan Jennings. So good to talk to you as always. We went way long, but thanks, Doc, for the info as always. And so good to talk to you. That's Dr. Ryan Jennings, Chief Medical Officer at St. Anthony Memorial Hospital here in Effingham. Doc, we'll talk to you next time.
Thank you. Keep yourself safe. Thank you. Keep yourself safe. Thank you. Keep yourself safe.